Welcome to Pharyngeal Arches Anatomy lecture. Pranam to all. One of the reasons to make pharyngeal arches lecture separately is because this topic has been asked in almost all the FMGE exams. It is a very important topic. Therefore, we are going to study it extensively in detail. This is Dr. Auroraj. Now let's get started with pharyngeal arches. Let's start from the basics. Trilaminar embryo gives rise to ectoderm, mesoderm and endoderm. Remember, ectoderm gives rise to the clefts, mesoderm gives rise to arches, endoderm gives rise to the pouches. Very important. Ectoderm, outside the name itself, it's further classified into neuroectoderm and also surface ectoderm. Now, in embryology, we have also extensively studied about the neural tube and also neural crest. For those who haven't studied, please go to the upper limb video lecture. You will study also about the embryology on neural tube and also neural crest. We studied that neural tube will form the CNS neurons, oligodendrocytes and ependymal cells. Neural crest cells, derivatives are going to be PNS neurons, Schwann cells, glial cells and also adrenal medulla. The surface ectoderm, surface as the name suggests, is going to give rise to the epidermis of the skin, hair and also nail, sweat glands of the skin, lens of the eye and also olfactory of the nose. These are all questions which are also being asked. And if you want to know more extensively, look at this is how the arches are. This region right over here, these are called as what? The cleft, and this is going to be the pouches inside. These are called as the pouches, which are formed by endoderm. Pharyngeal arches, they gives rise to structures of your neck and head. What are the structures here? Namely cricoid cartilage. We have in the ear we have malleus, incus, stapes. We will study one by one shortly. Now remember, pharyngeal arches gives rise to structures around the head and neck. Yes, there are going to be 5 arches. Remember, the 5th arch gets obliterated. The 6th arch is present deep and may not be visible. Yes, look at the image here. This is going to be the first arch. Here we have the second, the third, fourth and the 6th. Beautiful. To know it more extensively, look at the image here. This is the first arch, second, third, fourth and the 6th. Beautiful. The outside region here, this is called as what? The cleft. These are called as the cleft. And these one inside, these are going to be the pouch. These are called as pouch, and these are going to be what? The arches. Good. Let's study what are the derivatives of pouch, clefts and also the arches. The word pharyngeal means branchial. Yes. Look at the beautiful embryo here. What is this? First arch, second, third, fourth. The 6th is not visible because it is deeply located. Yes, as we know by now, clefts being formed by ectoderm, it gives rise to the skin. Arches from mesoderm gives rise to bones, vessels, muscles and nerves. Remember, bones, vessels, muscle and nerves. Pouches from the endoderm and then give rise to the glands. Yes. This image is going to be the important image of the pharyngeal arches. Please focus. This region right over here in orange color, this is called as the first arch. What are the derivatives? What do we see here? We see the malleus, we see the incus and also the Meckel's cartilage. Meckel's cartilage, malleus and incus are derived from the first arch. Second arch, we can see stapes, styloid process and also stylohyoid ligament along with the lesser horn. You see a lesser horn of the hyoid bone. In the third arch, we see the greater horn of the hyoid bone and also the body of the hyoid bone. Very good. In the fourth arch over here, you see the thyroid cartilage and also the sixth arch you see the cricoid cartilage. So remember, this is the first arch, second, third, fourth and the sixth arch. Beautiful. As it is also important to know the nerve supplies, skeleton, cartilage and muscles, let's study it in depth. Now remember, the first arch, it is supplied by fifth nerve, trigeminal nerve, which is going to be the mandibular nerve, and it is going to give rise to the Meckel's cartilage, maxilla, mandible, zygomatic and also malleus and incus. These have been commonly asked. What are the muscles? Namely, anterior digastric, mylohyoid, tensor veli palatini and tensor tympani. These are the muscle supply, and the ligaments are going to be sphenomandibular ligament. Sphenomandibular ligament, yes. Now the second arch, please remember, it is supplied by facial nerve. Gives rise to the right chest cartilage, stapes. Second, yes for yes, stapes. We have styloid process again, starting with yes, and the upper half of the hyoid body and lesser horns. Lower half of the hyoid body is formed by the third pharyngeal arch, supplied by ninth nerve, glossopharyngeal nerve, yes, and the greater horns. Please remember this. It is going to also give rise to stylopharyngeus. Stylopharyngeus is derived from third arch. From the fourth arch, it is supplied by 10th nerve, vagus nerve. It gives rise to thyroid cartilage. Muscles are going to be the cricothyroid, levator veli palatini, palatoglossal and the pharyngeal constrictor muscles. Sixth arch, again it is deeply located, so may not be visible. It is supplied by vagus nerve. 10th nerve gives rise to cricoid cartilage. Muscles are going to be the laryngeal muscles. This one, if you can remember, let's discuss about the pharyngeal cleft and pouch. The first cleft is going to give rise to external acoustic meatus. Second, third and fourth will give rise to cervical sinus. Easy. Pouch. Discussing about the pouch. The first pouch gives rise to eustachian tube and tympanic cavity. Second, it gives rise to palatine tonsil. Third, gives rise to thymus and the inferior parathyroid. Remember, third one, inferior parathyroid, whereas the fourth one gives rise to superior parathyroids and also the ultimobranchial body. It is of the parafollicular cells of the thyroid. These are all very, very important questions which are being framed in the exam, so please remember them. That was a quick revision of the pharyngeal arches. I hope you have understood the concepts as well the important points to be remembered for the exam. You guys are doing great, champions. Keep working every day, start gaining more knowledges, and you are going to get the exam cleared by this December. All the best. Thank you.